Hi, I'm Dr. Rob Rozbruch, and I want to tell you about how I'm treating bow legs. Bow leg alignment is illustrated in these three drawings. The line between the hip and the ankles goes through the inside part of the knees. In knock knees, it's just the opposite, and the line or the line of force goes through the outside part of the knees. And normal alignment, which is the goal, that hip to ankle line goes right through the center of the knee, and that represents the way force is transmitted through the knee. Now, bow legs causes a lot of extra stress on the inside part of the knee, and that causes problems. Here you can see a patient who has had bow legs for quite some time. The lines between the hip and the ankle go way to the inside part of the knee, and this causes arthritis. It causes a lot of extra stress on the inside part of the knee, and here you can actually see how there's bone-on-bone arthritis on the inside part of the knees. So this leads to the problems of knee pain, awkward gait, problems with body image, and future arthritis. This graph also illustrates how the pressure or the force on the inside part of the knee increases from about 400 to about 1500 with about 10 degrees of bow leg deformity. So we know that deformity overloads the respective compartment of the knee, and our goal is to get the line down the center back to neutral alignment. Here you can see Diane with bow legs and external rotation, and after treatment she has great straight legs, no knee pain. Now the tools of the trade for this include several, including a plate on the tibia, plating the femur and the tibia, the use of an intramedullary nail, circular external fixators, and even knee replacement. This is Jose, and this is the most typical way that I will approach a moderate bow leg. You can see he's got a lot of extra space between his knees. The long x-ray shows that the line goes through the inside part of the knee. With a virtual surgery, I'm planning an opening wedge correction, and that restores the neutral alignment. In surgery, I'm able to perform the open wedge osteotomy and temporarily put in a spacer and confirm in the operating room that the line between hip and ankle goes through the center of the knee. This is then replaced with a bone graft and a titanium plate, and you can see that he has neutral alignment. Here's an example of severe bow leg and after treatment neutral alignment. This is Ryan, large bow leg alignment and after treatment. Now Ryan's case was very severe, and here is the long x-ray showing the large varus or bow leg alignment. I planned a virtual osteotomy with femur osteotomy and tibia osteotomy, 2-level, and this is the execution of it. Here you can see Ryan's long x-ray before, and this is after, showing big difference in his alignment. This is Eric before and after treatment. This is Haig before and after treatment. This is Lawrence before and after treatment. This is Amy before and after treatment. This is Anthony, large bow leg alignment. This required the use of fixators. This is at the end of the correction and after full treatment. This is Carol before, large bow leg alignment with arthritis of the knee and leg length discrepancy, and after treatment. This is Nicole before. She has a large varus deformity related to fibrous dysplasia. This required the use of a fixator to correct the alignment and the leg length discrepancy, corrected her alignment beautifully, and this is her after treatment. Her gait was severely affected prior to treatment, difficulty walking, and after treatment, she had a transformative experience, huge improvement in her quality of life. This is Carlene before, during, and after treatment. This is Olga before and after treatment, correcting the bow leg and the leg length discrepancy. So the outcomes of bow leg treatment correction are improvements in knee pain, improvements in the ability to walk, straight legs, and it protects the knees from developing arthritis. It really makes people happy, and in generally speaking, they're very satisfied with improvements in body image and confidence and happiness. So going back to the tools of the trade, I plate the tibia, which is the most basic and most commonly used treatment for moderate bow legs, and I do an opening wedge osteotomy. For a larger bow leg deformity, I will do a 2-level osteotomy of the femur and the tibia. I will use intramedullary nails when the apex of the deformity calls for that type of a treatment. Circular fixators are generally used for large or complex deformity, including multiplanar deformity and also rotational deformity, and this allows gradual correction. And knee replacement is reserved for older patients who have severe arthritis. Thanks for your attention. I hope that this has been helpful to understand how I approach bow leg malalignment.